So today we're going to talk about his tumor treatment field. You see this thing that's on his head, it's actually a cancer treatment. What it does is it sends electrical voltage from pad to pad that goes through reproducing cells. And if you've ever seen like how cells kind of go like this, they show the picture of them splitting nice and neat. Well, the electricity causes them to kind of go like this. And so often they will self-destruct or they won't reproduce. And since cancer cells are fast reproducing cells, this helps slow the time or slow the amount of reproduction that happens. It's only been FDA approved since I believe 2012, so it's a relatively new treatment. It is only approved for glioblastoma, so people haven't seen it much. It only works while it's on, because you actually have to have the voltage going through the cells to help them not divide properly. The medical device is considered, you have to wear it at least 75% of the time for it to be of any effect. But there's new research that's showing if you can use it over 90% of the time, you get even better results. So since this is, he pretty much wears this all the time, right, hon?
Yep.
We're going to go ahead and change it, and you'll see what's involved in this. This is his unit that actually provides power to it. Yes, he has to carry it with him everywhere he goes. Right now we have it plugged into electricity. It does have batteries, but the batteries only last about 5 hours. And no, it doesn't charge while it's plugged into electricity. We've actually got a separate unit for charging batteries. So we're going to go ahead and turn it off. So the blue right here, the blue, if you can see that, I'm not too good at this yet. The blue is that the fields are on, so I turn the fields off and then I turn the unit off. And we have to replace these. They say in their literature, the company, that you need to replace them every 3 to 4 days. We replace them every day. We're here in Southern California where it's really hot, and my hubby's always had kind of a sweaty head and sweaty skin, greasy skin. And these I just replaced yesterday. And can you bend your head down for me? You can already see up here that it's starting to come loose. And if these contacts come off the head, then the treatment isn't working properly, and also it causes burns. Because this has electricity going through it, if you get sweat, moisture in there, it seems to cause more burning. Since we started swapping them out every day, we've done a lot better. Go ahead and lean back for me, hon. One of the things is when you do this type of treatment, they actually ask for an MRI, and they actually design the layout for your type of cancer. So not everybody wears them in exactly the same pattern. His cancer's right over here, so the forehead, to get it in here, it's got to be down, because these two work together and these two work together. And so this is all shifted to try to focus where the cancer cells are. And because this is on his forehead, before we started changing these daily, he easily, even now, sweats these right off. And then he'd have little burn marks on his forehead where the actual transducers are. And because this is medical equipment and whatever, this has to be sent back to the company. They provide us return address labels to do that, and a bag to do that, and everything else. Now what we're going to do is we're going to give his head a break, but here's the ones. Here's just, as you can see, some old ones. This is what we do. We put them in here, and what will happen is when we get our next delivery, I have a box with a return address label, and I will send these back to the company. The UPS guy is used to that when he delivers something, I very well may be returning something, because it also happens with his medical equipment. Now we're going to go to something slightly different. That is literally for treating his cancer. It's FDA approved. It's a medical device. Now this is something totally different. This is from the company Violite, and they produce equipment that does laser light therapy. Now, I decided to go with this because obviously brain cancer and brain surgery is going to cause injury to his brain. And one of the things this is supposed to do is to help heal the brain. And it's also good for your blood vessels. The nose one here I'm going to put on, this has got a light inside here. There's a lot of capillaries, they say, up inside the nose going back. I'm going to turn this one on here, so it's on. It lasts, I think, 20 or 25 minutes. We've been using it for over a year now. We actually have 2 units. They're at slightly different frequencies. So that's called the alpha, and this is called the gamma. The idea is there's these lights here, that the light actually goes through the skull, because bone is permeable to light, and it goes to the brain, and part of the research has shown that the laser light feeds the cells, just like food feeds the cells, but you don't have the oxidation process that you get with eating. So it's also been shown to make the blood slipperier. In other words, the red blood cells aren't as sticky, so they slide more. So without it making the blood quote-unquote thinner, it should help with preventing blood clots. And there's been some study to show that this type of stimulation can help with brain cell, converting stem cells to neurons. They did a small study of 5 people with Alzheimer's, and they found that using the device, that all 5 of them had some improvement. And then as part of the study, they had to take the devices away, and they saw the improvement go away. I do use this myself, and I do feel like it kind of stimulates my thoughts. With healthy people, I believe they recommend that you use it every other day, but he obviously has major issues, so we use it every day. It doesn't hurt or anything, right, hon?
No, it does not hurt.
It is uncomfortable, though, because as you can see, the design is not made for comfort. So it's not comfortable, but it doesn't hurt, it doesn't burn, there's no heat coming out from these lights. But because they're right on the skull, you're going to see that when I take this off, that he's going to have little divots in his head where this is sat on there. Is there anything you'd like to say about any of this stuff I've talked about?
There's not much to say. There's no pain. That's a good thing.
Well, tell me about carrying the Optune around. You know, a lot of people talk about it being too much work or too much of a hassle. What's your opinion on that?
Most of the time, and I'm going to more be sitting there at the 95, no. I'm trying to think of 3, so 70% or something, 80% is when you were using it, and they would be always working up in here and such. There's no actual there's nothing hot, there's no burning or any of this, that, there's nothing going on here normally. And you don't actually have any burning or anything. But I'm trying to think of...
Does it itch?
Not really itch.
But
there could be, but not really.
But the tumor treatment field's a little warm, right?
Yes, it does get out a little bit hot. And this right here, making in your dragging along, yes, it could. It does. It can.
But how difficult has it been to carry your unit with you?
No real problem.
Have you ever dropped it?
Yes.
More than once?
Yes. Quite a number of times, yes.
So obviously we try not to drop it. We actually change out the unit every month, and either a rep comes here and physically swaps it out, or she sends us a unit and we send it back in the same box. And what she does is, again, because it's a medical device, and I think last I read in my paperwork, this costs $21,000 a month to use. So it's not cheap. So you have to have documentation that you're actually using it. So she actually downloads the information from the unit, and she actually texts us back his usage rate. So we know for sure what his usage rate is. And normally we're somewhere between 92 and 96% in the last, I don't know, probably a year. So we keep it at a really high usage rate. But it'll also tell her things like if there's a big static discharge, because that can actually reset the machine because it is an electronic device. Or even if we drop it, sometimes she'll see that type of stuff. But every time we turn it off or turn it on, or there's an alarm, she gets a report on all that. And if there's something unusual, she'll contact us. Otherwise, she just sends us the report. And she may even, this is all done, she does that all text, which makes it easy. And then I've actually got like all the usage history ever since he's used it, because it's in a text. I can go back to what he used it for before. Because remember, he's had this brain cancer for almost 3 years, and we started using this in March of 2017 is when we first started using. Some people refer to it as Optune, but the actual therapy is tumor treatment field. For me, when we're out camping and stuff, the batteries have been a real challenge. We can ask for extra batteries, which we did, but they, like I said, they last about 5 hours. Well, that means pretty much on any night that we're sleeping, I'm going to have to change them twice. Because, you know, normally he's in bed about 11 hours to get his 10 hours of sleep. For anybody who has a Fitbit, you know what I'm talking about there. And so, let's say we're sleeping at a rest stop. If I have to wake up and swap his batteries out twice during the night, because it's an unfamiliar environment and everything else, it can be really hard for me to get back to sleep. So just this year we purchased solar panel and battery, and that has made it so much nicer. So now I can plug him into the battery at night, the solar panel battery, the generator battery, and it'll last all night, which is just awesome. The other problem we have is his charging unit takes 240 watts, which again, if you want to run that off a battery, you have to have a lot of juice to do that. But before that, we would just go to Starbucks and haul everything in and charge everything up. But it takes about 2 hours in the recharger to charge the batteries, but it'll charge 3 at one time. So I have to, of course, remember everything. We're lucky we're in California. The heat is a problem. Actually, I think this particular unit we have this month has a challenge, because it seems to me to be more sensitive to the heat than some of our others. You know, after a while of doing this, you know how many alarms you should be getting. And this alarm's way too much, so either the fan isn't working properly in it, or there's something overheating in it. And I'll be sure to tell the person when I send this back that this one had problems and it needs to be investigated. Where was I at? Alarming. It doesn't do well in the heat. Right now in Southern California, in the summer, you know, over 100 degrees outside. If he goes into the sunshine, it's not just the unit that's alarming, it's the things on his head get too hot. And so if he's in the sunshine, even putting a hat on may not be enough to stop it from alarming. So this time of year in this area, it's really hard for him to do anything outside. I was saying we're lucky, it doesn't rain a lot, so obviously you have to keep this dry. So rain is an issue, and his head dry. So we always keep umbrellas with us, but here in Southern California it doesn't rain that much, and if it does rain we usually know it ahead of time. Like it says, you just plan around it. The batteries are batteries, they're heavy. The batteries, they provide us with cases to put the batteries in, but it's a pretty big battery, and if you're carrying 3 or 4 of these around, it's a pain in the behind. So, like when we was at Comic-Con, you know, I'd need to carry well, at least 2, possibly 3 spares, because also if they start to go bad, they don't last as long. You don't always know that ahead of time. Any other challenges we've had taking them with us?
Not really.
Do you feel embarrassed at all about wearing them?
No. There's no embarrassment. Yeah, no. I'm not thinking of that, whether I can think about it or say it or whatever right now, no. But,
we do get a lot of comments about it. A lot of times people, they don't know what to think about it. A lot of people will think, like if we're at the hospital, they'll think he's getting an EEG done. When we were at the convention, people thought it was part of a costume. Otherwise, people, sometimes they say things like, "Oh, what a really neat hat," or something, and I don't know that that helps or not. We have another person who likes to say it looks like pennies from heaven taped to his head. But we just obviously we consider it treatment, and because it can be used in conjunction pretty much with all the treatments except radiation, and obviously when he's healing from surgery, it can't be on because he has a wound, and you can't put it over the wound. We use it all the time. And of the types of treatments for glioblastoma, it actually has some of the best track record for consistency, and the fact that the tumor cells don't seem to be able to get immune to it, which it does with the chemo and stuff. So it's our go-to. We've been using it since the beginning and we'll continue to use it, but a lot of people don't. And I guess, you know, if you're a woman, you might not want to shave your head and put this thing on there. I don't know. Some people have really sensitive skin. I've read that some people just, they get the burns and they can't seem to not get the burns. So we've been really lucky that his burns have been pretty manageable. When we say burns, we're talking about he gets like a little blister. And then, of course, you got to be sure you don't put it over the same spot because it's going to take a little while for that little blister to heal. All right, he's almost done with his laser light treatment. But these are they're called transducers. I have 2 that have a white tag and 2 that have a black tag. And the way it goes is it goes black, white, black, white. So I need to prep these, and well, if anybody's dealt with any medical supplies, you know how much everything is wrapped up and how much paper and stuff you end up with. I'll let you take the twist ties off. So these 2, one of the blacks and one of the whites I have to cut. And again, this was in our original layout that they provided for us based on where they're going to be placed and his cancer location. So the black on his forehead, I have to cut down a little, or the little knobs that come down too far, little pieces that hang down. They actually showed it cut a lot closer than I cut it, but if I do that, then it won't stick, so I can't quite follow their directions 100% there. That's why it's so far down his forehead. And of course, twist ties, twist ties. I normally have my hubby do the twist ties because I figure it's good occupational therapy, you know, for him to have to manipulate something small. Normally I have him do all 4, but today I only made him do 2. He's gotten better at it too. Anything that has small attention to detail is great exercise. Isn't that right?
Yes, yes, it's very good.
I'm not just a slave driver, right?
Yes, you are.
Now, before we put these on, I'll be shaving his head. The company provides the razor. It's actually pretty cool. The old razor was not pretty cool. The old razor, we'd have to change the blades all the time. It was a regular, like, face razor. Now, they have, it's called, well, it says Pitbull on it. Pitbull Gold. This is designed specifically for shaving heads. You can see that, and the thing is really movable. It's easy to hold. Obviously, it's rechargeable, but this makes shaving his head a lot better. I don't have to change they provide the replacement heads and everything, blades, but I don't have to do it near as often, get the blades replaced near as often. And this just goes so much faster. The downside is that, of course, you do have to use water and everything, so water's a little bit messy, but it's worth it for the quality of the shave that we get with this. The other one, the one I used to use, it would do okay for a little bit, but then any hairs that it missed would be longer next time, and then longer again, and it could never get them. So then I had to use another clippers to clip the hairs down so that the shaver could shave the hairs off. And I would have to do that every 3 or 4 times of shaving his head. So that meant also when we were traveling that I had to carry both sets of clippers and everything. This is much nicer. We started using this, they started providing this about a year ago, I think. We've actually seen a few changes in his tumor treatment field where they've made improvements on things. As he's been using it long enough, they've had time to make improvements. We're expecting this thing to finish any time now. There we go. Beep, and it's done. So we did do both of these, and yeah, you can kind of see the spots on his head from putting that on there. Now again, remember that what you're seeing, we literally do every single day. Occasionally, we might not do it. But if we don't, well then the transducers start to come off, and then his use time goes down because it alarms, especially when he's sleeping. Because when the unit has an alarm, it's actually stopped doing its therapy. And if he's sleeping and he doesn't hear the alarm, then it means it just sits there beeping until eventually he turns it off. And because he likes it a lot hotter than I do at night, we don't sleep in the same room. I will if I need to keep an eye on him or something, but generally speaking, I like it freezing when I sleep, and let's just say he doesn't. He's actually gotten a lot more cold tolerance since we stopped the Avastin. The Avastin just made him feel frozen all the time. And that's because Avastin affects blood vessels. So it actually makes sense. He stopped the Avastin back in February before his third brain surgery in March, because you can't be taking Avastin unless it's an absolute emergency and have surgery because of it affecting the blood vessels and such. And now, of course, before we put this on, because we want it to stick well, we actually use alcohol to help remove all the grease. You're seldom going to see him without his thing on, so can you turn your head that way? No, it's not going to show. Never mind. I was going to show your scar, but it doesn't matter. He'll have surgery again soon enough, and he'll have a new scar, so there you go. So, again, black lead. And also, like, if he goes to the hospital and gets an MRI or something, we need to do this at the hospital after the MRI, put these on, because they have to be taken off because, you know, it's a giant magnet. You can't have any metal in an MRI. Or when we're out camping or traveling to the national parks and stuff, obviously we have to do this wherever we are. And especially if we're doing it every day, you can just see where it's a little bit of work. It's not huge. I mean, we've been doing it a long time, so we've kind of gotten used to it. And like I says, I've been putting these on a long time, so I have a certain my way. And like the white one I cut is so that this black one is actually over more. Both these black ones are more this way. And yeah, over the years I've learned that just tapping his ear is the easiest way to let him know I want him to hold his ear for me, because I can't. It takes two hands to hold this sticky pad, and if I try to hold it and hold his ear, the sticky pad tends to flop onto itself. So yeah, I tried that in the past. Not a good idea. So I turned the unit on while I'm getting ready to plug these in. One of the problems with this unit is that this part gets unplugged fairly often, and it'll alarm, and then you got to go in and you got to plug them back in. But it's just white to white, and then black to black. Doesn't matter which ones, but these actually you have to push pretty hard to put them in, which is amazing that they actually come undone. Now I'm going to turn the treatment on. And then this was one of the things they came up with in the last year or so, was something to put these in. Before that, you used to have to use tape to kind of tape them together, or zip ties. I use zip ties sometimes on part of it because the zip ties were easier. But this is much nicer, much easier, much less time. Because what you'd have to do is you'd either braid it, which just takes time to braid it, and then tape it, and then, you know, it just, now with this it's a lot faster, she says, as she tries to get it in there. Now as far as traveling goes, we have a letter to give to say TSA if we need to, explaining what it is and everything. But sometimes we do go into, let's say, a government building, you know, with the metal detectors and everything, and then they see it, and they're not aware of what it is. I think they're starting to become a bit more aware, but obviously someone with wires hooked up to their head just looks suspicious. But it's getting better. And you see how he kind of like flops it down so that it's comfortable for him, and then he kind of sets this here so it's not like pulling on his head. They do provide a clip where I could clip it to his collar, but a lot of that stuff, it sort of works, it sort of doesn't work, and then you got to remember it's there when you're taking your shirt off, or you can fling the piece all over the place. So, but we think it's well worthwhile, and like I said, we've been doing this treatment since March of 2017, so quite a while. And now that we change him every day, I think we started changing him every day about a year ago, and I don't think, well, maybe he's had like one minor burn, and that was because of the way he had his head shoved into his pillow. Again, depending on how he sleeps, he can affect sweating or the way the patches sit on his head, because obviously, as he said, these produce some heat because there's electricity running through them. In the first couple months it bothered him, but since then it hasn't bothered him at all. But if he covers his head with the blanket, it can overheat and alarm. So I have to remind him that. But also if he just shoves his head into the pillow a certain way, it doesn't get to breathe enough and it overheats and his head gets hot and he sweats and then he gets a burn. But I think he's only had one burn in a year now.
Okay.
So it's really changing him every day has been one of the best ideas we had. Before that, we did every other day or every third day. Now, occasionally we go 2 days, but usually we change him every day. And the company will provide us with as many transducers as we ask for, as far as, as long as we're doing the medical treatment. So please, if you're enjoying our videos, please subscribe. Please tell other people, and we're open to questions, comments, as we do more and more videos. So, I'm Zena Gen Van Dar. Thank you for watching.